Good evening, good evening, good evening. It's Musu of Listen to Your Body. I'd like to just so many great things happening. June is Men's Mental Health Awareness Month. June is also June is also the hey
Hi, how are you?
is Oral Health yeah, Oral Health Awareness Month as well. And we are here with Melanie. Hi, Melanie. How
Hi,
are you?
how are you?
I'm good, thanks. It's good to see you.
Nice to see you as well.
Yes, thank you. Thank you for coming on again. It's such a pleasure because I was just saying it is Oral Health Awareness Month and for the month of June. And we wanted to bring you on a couple of times this month just to check in and do a brief check-in because last time we spoke with you, it went so well and you gave us so much information. We still had a lot of topics that we didn't get to discuss because you're so well versed in the work that you've been doing for over 20 years. I hope you don't mind that we're just tapping in and asking questions. We do have someone who's asking how you're doing. I'm well, thank you. And how are you doing, Melanie, today?
I am fantastic.
Yeah.
Thank you for asking. And whoever that is, thank you for asking as well.
Okay. So, let's get into it. June is Oral Health Awareness Month. What are the things that you normally look into and look at during this time of the month?
So, health awareness, oral health awareness, the gold standard for a healthy mouth is brushing and flossing. And so it
Mhm,
sounds so simple, but with the toothbrush, there are many, many things that we need to think about. So, the bristles should always be soft. And
mhm,
I know patients are always asking me, well, why do they sell hard? Well, they sell cigarettes, and cigarettes cause cancer. So you have to be an educated consumer and get what's best for you. And
mhm.
so we only recommend soft bristles on a toothbrush.
Very
Also,
good.
for the toothbrush to work effectively, you should change the bristles every 2 to 3 months. And I know there's a huge question whether a manual or an electric works better.
Mhm,
I always say to my patient, the one that you're going to use works better. So as long as you're going to use it for 2 minutes in the morning and 2 minutes before bed, that is the best one for you. Now, electric toothbrushes are great. They're great because they may have the timer on it that you need in order to attain that 2 minute brushing time.
mhm,
Also, some electric toothbrushes will have a power or pressure sensitivity on it so that you're not brushing too hard.
mhm.
So, like I said, so brushing and flossing are the gold standards for oral health care. Now, when it comes to flossing, um, you it depends on what's happening. So, if you have a little gap in between teeth, if teeth are not
Mhm.
touching, you might want to use a little brush, a little interdental brush to get in between the teeth. Um,
Oh,
the
wait,
other
can we see that again? Because I'm sorry, I need to see that again.
Absolutely, yes.
Okay.
I can actually even
Oh.
take it out of the package so that we can see it up close and personal.
Mhm.
Um, this is a little brush that you can use to get in between the teeth if there are spaces in between your teeth.
Nice. Okay. I always
So,
wondered what they were for, but nobody's ever, I've seen them before, but I had no idea what the purpose was.
yes, yes. Or if someone has braces or if someone has a bridge. So there are floss aids that can help attain the clean in between and underneath um, appliances in the mouth.
Okay. So, and someone said in the chat, like an oil change for your mouth. So basically, what you're sharing is information. It's like an oil change for your mouth.
If that's how they want to think of it and it makes them do what they need to do, sure.
Yeah.
Absolutely. Absolutely.
So speaking of oil, I didn't get a chance to ask you the last time. I've seen it and heard about it more often now than I have in the past. Oil pulling. What are your thoughts on oil pulling? Are you familiar with them? Do you know what the purpose is, especially when it comes to how they affect the teeth. I think, in my mind, I think the pulling is for the tongue and the throat. But what are your thoughts and what's your knowledge on oil pulling?
So right now, the evidence isn't conclusive that it does a whole lot. Um, it's supposed to be natural and have olive oil, cinnamon, spearmint, all those kind of things. Some of the oil pulling can
Hmm.
have alcohol in it, so that is not good for the mouth. Alcohol dries the mouth out. So whatever you get, whatever you are choosing to use, you may want to read the ingredients
Hmm.
prior to using it so that you know that it's going to work well for you and what you need. And
Oh, thank
also
you.
talk to your oral health care provider. So because they will have information on your medical history and you guys can come up with a plan to find out what products are going to work best for you. So oil
Nice.
pulling,
Hmm.
I have not really recommended to my patients, nor has most of the healthcare providers, oral healthcare providers in the facility where I work.
Hmm.
However, what I could do is for whoever is the first person who sends me their address. I have a sample here that I have received of an oil pulling kit with a
Oh,
tongue scraper
nice.
and a toothbrush. And it's in a handy package that they can carry with them. So here's a sample for someone to try. The first person who sends me their address in my inbox, I will send it to them and they can use it and see how well it works for them. It is only a
Nice.
sample, so it may not be a large enough sample size to adequately see if it works well. But it's a nice sample. Uh,
It's worth the try. It's worth the try.
exactly. And I said it has a tongue scraper. So that's the other thing. So the teeth are, we talked about the brushing, the flossing. So the tongue also needs to be brushed. So removing that bacteria from the tongue helps to clear off the food particles and bacteria that can cause bad breath. And also, it can alter the taste of the food that you are eating. So you might want to eat the food, taste the food and enjoy the food you're having today, not what you had 2 weeks ago. That's now a little,
Oh, yeah.
you know.
Oh my gosh.
So brushing
Okay.
your tongue daily, brushing your tongue. And the other thing is that there are some studies that say the bacteria from the tongue could be possibly transferred back to the teeth, and that could contribute to cavities. So
Oh,
brushing your
wow.
tongue helps to satisfy a number of goals for keeping your mouth healthy.
Okay, thank you. So when we brush our teeth, we got to make sure that we brush our tongue.
Absolutely. And I know some patients like a tongue scraper. You can use whatever you choose to use, either the toothbrush or a tongue scraper. Now, if you're
Hmm.
going to use an electric toothbrush, you might want to turn it off um, before brushing your tongue with it, just because it just gets a little messy. But I mean, whatever works for you, feel free to do it.
Okay. And when it comes to tongue scrapers, I know that they have metal ones and they have plastic ones. Do you feel that there's a preference for one, or is it just whatever the person themselves prefers?
It's whatever the individual prefers. Yes, just as long as you're using something to remove the bacteria and food particles from the tongue. But
Okay.
absolutely,
Thank
absolutely.
you.
You're welcome.
And so I wanted to talk about whiteners. A lot of people are selling products. We've talked about it before, about trays as opposed to strips. And we also talked about, oh gosh, I forgot what other ways of whitening the teeth and just whitening toothpaste. Can you tell me, is that something that's necessary? Because I feel like a lot of people are very focused on having white teeth, but I don't know that teeth are generally supposed to be pearly white, like they say on TV.
So you are so correct. That is the main thing that patients ask for is white teeth. And my answer is I always start with, well, what do you think is staining them? Because if you do any whitening process and you continue to do the activity that caused them to stain in the first place, then it's going to stain again, right? So what is your
Mm.
goal, to have them white for one day, or you want to continue to have continuously have white teeth? So once again, I ask, what is the activity or food or drink product that can be contributing to staining? So coffee, tea, dark sodas, all of those can contribute to staining. So can curry, and I love curry. So
Oh.
there are lots of foods that can contribute to staining.
Hmm.
So any food that will stain a white t-shirt will stain your teeth.
I
And so
forgot that. Ugh. You said that.
ketchup has dye, for example, ketchup has dye in it. So a lot of foods have dyes in them. And so those dyes will contribute to the teeth being stained.
Hmm.
So even blueberries, which are good for you, can contribute to staining. So if I have blueberries, I floss and then I rinse out with water just so it doesn't stay on my teeth.
Hmm.
So that's what I always start with. What is contributing? And if you're smoking, that definitely contributes to staining. And the smoking could be whether you're vaping, whether it's cigarettes, whether it's hookah, all of those things can contribute to staining on the teeth. And so if you're going to
Mm.
continue to do that, then you're going to continuously have staining.
Okay.
Um,
Oh my gosh.
so that's where I always start with. And now if we're talking about whitening, um, oh, the other thing that can contribute to staining is if people are clenching or grinding, because what happens is the teeth start cracking. And so if they are cracking or breaking, then you can see the layer underneath the enamel, which is a
Hmm.
little darker. And so that will make the teeth appear stained. So these are things that you can talk to your oral health care provider about
Hmm.
because they will be able to tailor your whitening journey to what is happening with you exactly.
Okay. Thank you.
Yeah.
I thank you. I so appreciate that. We do have a question here. What about cleaning out your tonsils? No, I haven't heard of that before. I didn't know you can clean your tonsils.
I'm not aware of that either. And so if that person wants
Okay.
to share, if they have information on that, I mean, yes, you can gargle and you can
Mm-hmm.
gargle with peroxide, which is very safe. You can gargle with salt water, um,
Mm-hmm.
water mixed with salt.
Mm-hmm.
Um,
So
but
just straight, what kind of peroxide? Like straight peroxide you can gargle?
yeah,
Really? You don't have to
if
dilute it or anything?
you don't, you're not going to swallow it.
Oh, yeah. Oh my
But there
gosh.
are
Okay.
some mouthwashes that have peroxide in it. There's one called Peroxyl
Mm-hmm.
that has a peroxide formula in it. I don't know the concentration, but that is a good one as well. But yeah,
Wow. Okay. Listen, this is good to know. I wow, I always thought peroxide is like one of those unsafe things. Anyway,
well,
you
once
mhm,
again, you're not going to swallow it. You're just going to
mhm.
gargle with it and spit it out. Spit out as much of it as you can.
Okay. One of my other questions that I had going back was oh, forgive me. Um, was about the teeth, the yellowing, the permanent yellowing of your teeth. So what if are there any natural things that would cause permanent yellowing or certain kinds of yellowing? Because you mentioned the grinding, but if it's at the base of your teeth, what's usually the cause of that kind of yellowing?
So it sounds like what you're talking about is what we call recession, like a
Hmm.
receding hairline. So
Okay.
if your gums recede and the root of the tooth is exposed, the root of the tooth is naturally a darker color than the crown. So this is what we call the crown of the tooth. And
Hmm.
so the root of the tooth is naturally darker. And so the things
Mm-hmm.
that contribute to recession is brushing too aggressively. So we always
Ah.
advocate to brush thoroughly but gently.
Mm-hmm.
The other thing is if the toothbrush bristles are hard. So that's why we advocate for soft bristles.
Ah.
Um,
Okay.
the other thing that contributes to recession is the clenching or the grinding. So the teeth and the tongue are connected. So if one part is being traumatized, so is the other.
Mm.
So when a lot of people do that because of stress.
Mm-hmm.
And so we usually recommend a night guard, something to sleep with so that to protect the teeth and the gums from the recession, from the grinding and the effects of the grinding.
Mm-hmm.
So yes, so the
Oh.
roots are exposed, the roots are not going to bleach. They're not going to ever be the same color as the crown of the tooth because they're naturally darker.
Mm-hmm.
So prevention is the best thing to do. So prevent recession from happening. Soft bristles, thorough but gentle brushing. And if you are clenching or grinding, talk to your provider about ways that can you can prevent the effects of clenching or grinding.
Okay. Thank you. Thank you.
So,
This is
um,
so helpful. This is really, really important information that we're learning here because again, if you haven't heard from the beginning, June is Oral Health Awareness Month, and we are asking our lovely Melanie Sturrup all the questions that we could ask because you've been doing this for over 20 years. What is it that originally got you into just being um, a caregiver of teeth and gums and the health and wellness in the community?
so I think it was a combination of things. So growing up, unfortunately, my mom didn't take care of her mouth that well. She took
Hmm.
us to the dentist. She had 5 kids she had to take care of. Unfortunately, my dad was deceased, and so she had a
I'm
lot on her
sorry.
plate.
Hmm.
Thank you. She had a lot on her plate, so she didn't spend as much time for herself or with herself. And
Hmm.
so she at some point had to get dentures, and so that was one part. The other part is after seeing her go through that, I started working at a dental office. I was a dental assistant at a pedo office, and I saw all the kids that needed to have needles because they had to have a lot of dental work done. And it's not
Hmm.
fun. No one wants a needle. And seeing kids cry and scream and squirm and it's very unsafe for them to be moving like that when their needle is coming towards them. It's unsafe for everybody.
Hmm.
So I went to school to learn about prevention, prevention, prevention. And so I'm so happy that I have learned about it and I can share that with people. And so I hope that this helps someone in their daily lives because prevention is less costly than getting
Hmm.
something fixed or repaired, and it's so much more comfortable and it's less time consuming. So
Hmm.
the more time that an individual spends removing bacteria from their mouths and eating healthy and working out, the less time that they have to spend in the dental chair to get something fixed or repaired.
Mm. Okay.
Yeah.
Thank you. We have another question. Do you recommend using a water pick?
So a water pick, not instead of the manual floss. In
Hmm.
conjunction, yes. A water pick is very nice and it's very helpful for someone who has braces because if you have braces, it is a lot of work to floss. So a water pick is
Mm.
very useful. If you have bridges in your mouth, a water pick is very useful. Um,
What is a
so,
bridge? I don't understand that.
oh, I don't have any. So it's when a tooth is missing. And
Hmm.
in order to fill that tooth, they put
Oh, like
you
it's
can't
called a
put a crown in a missing
bridge.
tooth. Called a bridge. Yes, I'm sorry. Yes,
Okay.
yes,
Yeah,
yes.
no, no, no.
And
Okay.
so,
I didn't understand that one.
so as you said, this is Oral Healthcare Awareness Month, and so we will hopefully meet again, and I'll have a few more props so that because that's a great question, because I'm sure other people may have the same question, and so
Yeah.
I will try a few more props so that people will get the full picture.
Hmm.
But um, the water pick does work well in conjunction with the manual flossing. Now, I know people always want the easy way out. However, just think about this. When you get in the shower, do you just let the water run over you?
No. Oh
And
gosh.
you,
My
some,
9-year-old does.
right. I was going to say some people might, but in order to really clean, you need the mechanical motion of the washcloth getting things off.
Mm,
So the mechanical action of the manual floss works very well. The water flosser works well in conjunction, so with the manual floss. So now if
okay.
you want to do the water floss one night and the manual floss the other night, you wanted to interchange, then yes, absolutely. But don't just do the water flosser.
Got it. Okay. So I'm not familiar with actually I've gone to have a dental cleaning where they use water, and I just kept thinking to myself, I was like, is anything being done? Are we getting
No,
anywhere? Like mhm.
so I think, because I use that too, so I think what you're talking about is something that we call the Cavitron. And so it vibrates also while it's
Yes.
squirting water out. So it is
Hmm.
absolutely doing something, yes. And so
Okay.
that helps to remove hard bacteria. That helps to remove stain a lot easier and a lot quicker for the patient and for the clinician. So it
Oh.
absolutely is doing something. And yes, absolutely, yeah.
That's awesome. Okay, thank you because I wasn't aware. I'm like, can you do one or the other? But you've already answered that question. So I appreciate you, letting me know that. I did have there was another question about fillings. The importance of fillings for those who have fillings. If and this is a multi question. It's another multi question. What is the importance of the filling, first of all, when you have them? And if you lose one, what's the importance of getting it replaced?
So the importance of a filling is that the person probably had a hole. A cavity is essentially a hole in your tooth, and that hole was dug there by bacteria or
Hmm.
acid. And we're going to go into that a little bit about acids because there's lots of foods and drinks that are acidic. And
Hmm.
so they can create a hole in your tooth. And so if a hole is in your tooth, it can get to the nerve, which causes
Hmm.
severe pain. So anyone who's on here and you've had needed a root canal is because you probably had some severe pain because of that hole in your tooth. So if there's a hole in the tooth, the bacteria that's left needs to be dug out, cleaned out. So that's the drilling that you'll hear,
Hmm.
cleaning away the bacteria, and then it is filled with a material that is biocompatibility. So bio life is compatible with our lives and our health. So it's in the tooth colored one is called a resin. So they'll fill it with a tooth color to match your tooth color. And that is the significance of a filling. The
Hmm.
other part for cleaning the filling, if the filling is in between the teeth, where the filling and the tooth meet is a very weak area. So if bacteria is allowed to sit here, then that same tooth can get a cavity on it because where
Okay.
the filling and the tooth meet.
Hmm.
So flossing helps prevent that from happening again.
Okay. Thank you. And
Mhm.
so if somebody loses the filling from their tooth, what's the importance of replacing it?
So it's absolutely essential because so the filling most likely went into the second. So the layer that we see here, this is called the enamel, but
Hmm.
the filling probably went into the second layer underneath the enamel called the dentin. And the dentin is not as strong as the enamel,
Hmm.
so it can get a cavity easier. So if a filling falls out, the best thing is to go to your oral health care provider and make a plan. The plan will probably be to replace it. So
Okay.
depending on how long the filling has been out, so you may be able to get a simple filling again, or it may need a crown.
Okay.
So this, as soon as you can get an appointment to get into your oral health care provider, the better. Yeah,
Thank you. Thank you.
you're welcome.
This is so helpful to know. My children have they've had their own situations happening where, my daughter lost a filling, and I was like, okay, well, she's an adult. I can't really force you, push you, or make you, but it's important to go, I'm like expressing the importance of going back and
Right.
having it filled. And she's like,
Right.
well, she was in school, so busy. Oh, I got to do this and I got to do that, and my finals are happening, and setting
Mhm.
priorities. But I always step back and think about putting my health first, and then I also try to encourage that with them. You got to put your health first, because when things happen, the body's breaking down and you don't go and get it, like you said, prevention, or, well, treated at this point, because it's already
Yeah.
happened. If you
Yeah.
don't get treated, then things can get worse, and we don't want things to get worse. So I appreciate all
Absolutely.
of this information that you're sharing with us, because it's extremely helpful to know. Thank you.
Yeah. Yeah. You're welcome.
And so, before we go, is there anything that you would like to share, anything that you want us to know for the next time that we come back and start to talk about, for the next time this month that
Next
we come back
segment.
and
Yes.
talk more? Yeah.
So I want to talk about how the diet plays a part in good oral health care. So
Okay.
eating raw, hard fruits and vegetables like raw apples, carrots, and celery help to wash away some of the bacteria. And they
Mm,
also have vitamins and minerals in them.
hmm
So it's very, very important to do that. So your dietary intake does impact the health of your oral health care.
hmm
And as I said a little bit earlier, foods that are acidic, foods and drinks that are acidic can erode the enamel, which
hmm
can contribute to more cavities. Um, Foods that are more acidic can, and the things that are acidic, sometimes people don't think about, right?
hmm
Like apple juice is acidic. So if you're giving your child apple juice all day long, you could be contributing to your child having more cavities,
Mm, okay.
right? And so an apple juice doesn't have the fruit, the pulp that an apple has. So like I said, eating a raw apple will help wash away some of the bacteria. And you're not getting that same effect by drinking apple juice. I'm not saying
Mm,
not to drink it,
hmm
but just be aware of what is happening when you're drinking things such as apple juice.
Okay. This is good to know. This is very, very good to know. Thank
Yeah,
you.
you're welcome.
Oh my gosh. So thank you again for taking the time out to talk to us about June being Oral Wellness Month, and Oral Health and Wellness Month.
Yes,
And yes, it's important, Health and Wellness Month. It's an honor and a pleasure to speak with you. And so we're going to do this again on the 20th, is it the 26th, I think? It's the next Thursday.
yes,
Thursday the 26th at 8 p.m. So, we want those of you who are here to tune in, tell a friend to tell a friend, and come back and have some questions, because, we're here, and I love being able to ask you the questions that I myself want to know, and that our community wants to know, for better oral health.
yes, yes. And I am so glad that you are allowing me this platform to share this information. That's the other thing that I've noticed in my, like you said, my 2+ decades of working with the public is that there is so much information that is not known or unknown for some reason.
Hmm
Um, and so I am so happy to be able to share this, and hopefully someone will benefit from this information that we are sharing with
Thank
them.
you. Yes, I thank you so much again. I appreciate you. And we'll go more into physical health and the dental health next time. We'll see
Yeah.
everybody 8 p.m. and that's going to be June 26th, 8 p.m. right here with our specialist, our dental specialist.
Yes, yes.
Yes.
Well,
Melanie
look forward
Sturrup,
to it.
thank you.
You're welcome. Good night.
Have a good night, everyone. Take care. Thank you.